The insurance industry has dropped a bombshell. It said that for the average family, the Bacchus plan would raise the price tag for their private health insurance by $4,000 each year within 10 years. The White House immediately attacked that report as biased because it was commissioned by the insurance companies. Who's right here? The answer could cost you big time, and we wanted a fair and open debate on the issue. Joining us now to give us two sides are Gracie-Marie Turner, President and CEO of the Galen Institute, Bernard Whitman, a former advisor to President Bill Clinton and the president of Whitman Insight Strategist. Now, here's the ground rules, everybody. 30 seconds each, no interrupting, not a shouting match, please. And here is the first question. Let's start with this one, and I direct it to you first of all, Bernard. Are healthcare industry cost projections accurate? 30 seconds starting now.
In a word, no. These are the exact type of negative attacks that losing politicians trot out in the days right before an election to scare the public and to try to tear down their opponent. But the truth is, the American public are sick and tired of these types of attacks, and they are demanding health care reform now. The truth is that the health insurance industry are seeing the end of the days of wine and roses. They have been raking in money fist over fist, and it's about time that we bring cost controls into the insurance process.
30 seconds. Got it. All right. Thank you very much. Gracie-Marie Turner, 30 seconds. Same question. Go ahead.
It's exactly true. What we need to do is bring lower costs to the American people. That's what they were promised in health reform last year. During the campaign, President Obama said, we are going to lower health care costs by $2,500 for the average American family. Now we know that their costs may not just be lowered by $2,500, but they're actually going to be increased by up to $4,000. It makes absolute sense that if you are going to increase taxes on health insurance, if you're going to increase taxes on medical devices, you're going to wind up raising the cost of policies.
Okay, I'll give some exchange a little later on, but I want to get to question two because we've got a lot of ground to cover here in a fair and open fashion. Here's question number two. Can you cut health costs without rationing care? Gracie-Marie Turner, to you first. 30 seconds starting now.
The private sector could do that, and they do it all the time by making things faster, more efficient, but the government doesn't use the tools the private sector does. It uses price controls, it uses hatchets, it uses cuts in benefits. There's no way to get to the kind of efficiency that we want in the health sector through government mechanisms. They just don't know how to do it.
Bernard Whitman, can you cut health spending without rationing care? 30 seconds starting now.
Absolutely. The entire point of this plan is to control costs, ensure that those who do have coverage get the coverage that they have paid for and deserve, and extend coverage to those who don't have it. The truth of the matter is, healthcare rationing is going on right now through denials of service and coverage, and people are dying as a result. By extending coverage to everybody, we are finally going to be able to introduce efficiencies into the system and require insurance companies to compete, something I cannot understand why they are so afraid of doing.
Excellent. We all stuck to our 30 seconds apiece, but I want a little follow-up here because, Bernard, you've just really said that you trust government. You believe that government can cut costs and it won't end up in rationing care. I have to question, do you really trust government?
The issue is not whether I trust government. It's about time that we introduce. No, it's about time that we introduce more accountability.
The government has a lousy track record of controlling costs. Go ahead.
Let's look at what happened when we relaxed accountability, regulation, and controls in the financial markets. The system collapsed due to a lack of regulation, not over-regulation. I think common sense would suggest that a little more oversight and a little more regulation will ensure fair competition, not unbridled profit-making that the insurance companies had been able to get away with for decades.
Gracie-Marie Turner, you seem to support private enterprise. You say that private enterprise can reduce costs. It doesn't have a track record in reducing costs for private enterprise, private health insurers. Go ahead.
Well, it does. When you look at consumer-directed health care plans that many companies offer, the cost increases are a third as high as regular traditional insurance, and it's because they've engaged consumers as partners in managing costs, rather than trying to do this top-down, government-regulated, you get to have this benefit, somebody else gets to have that. It's all going to wind up with more taxing, more spending, more government control, and less of the kind of free market options and the less of kind of free market initiatives that actually control costs in the rest of the economy. We have too much regulation in our health care system, not enough.
Gracie-Marie Turner and Bernard Whitman, it was an excellent debate, free, open and fair, no shouting, and you're kept within your time frame. That's superb. Thank you very much, one and all. We appreciate it. Thank you.
Thank you very much.
Thank you, Stuart.